Welcome to SVG Television's Evening News and Sports for Tuesday, October 15, 2013. I'm Carol Cato, and these are the details. A fourth medical school is expected to commence operations here next year. This was announced earlier today at a media conference held by Prime Minister Dr. Alf Gonsalves, who says that the St. James School of Medicine, a branch of the campus in Bonaire in the Netherlands Antilles, is looking at an area in South Leeward to set up. PM Gonsalves says the school has already obtained accreditation from the local accreditation board and is expected to begin operations next May.
Students, I understand from the St. James School of Medicine, they said that they will start with about 60 in May. And within 3 years, they intend to ramp up to a number in the region of 200 or beyond. So they have a very good recruitment program policy.
The St. James School of Medicine will join the Trinity School of Medicine, All Saints, and the American University of St. Vincent and the Grenadines, already operating here with over 400 medical students altogether. Meanwhile, PM Gonsalves reports that his recent trip to Argentina bore fruits in a number of areas which will assist with SVG's development. The areas of technical cooperation between Argentina and SVG include airport and port development, Coast Guard training, health and education. PM Gonsalves says he was able to secure 5 graduate scholarships from Argentina, noting that his government is now interested in securing more of these scholarships from other countries for Vincentians to pursue academic studies at a higher level.
Don't want a student who is bright, a young person, young man or woman, not to have the ambition to go and do their masters or their PhDs, because they don't have the resources, the money, because the government cannot afford to fund masters and PhD programs. You may be able to assist in some limited way. So a focus is for me to get some PhD and scholarships for PhDs and masters. We need to look now at a higher level to deepen the extent of our professionals' education and training. Now, who would have believed when we started in 2001 that by 2013 you would hear a public policy which is focusing not just on undergraduate, not just on the university education, but on postgraduate. It's a remarkable development.
The PM says from Argentina he was also able to secure training opportunities in the area of medicine for Vincentian students, as well as postgraduate studies for doctors. He said structured regular visits by Argentinian medical teams to administer specialized services to Vincentians are also in the pipeline. And the Prime Minister made it clear today that his recent trip was at no cost to the government of St. Vincent and the Grenadines.
Even if it did, the benefits, you can't just look at a cost, you have to look at the benefits. If anybody believes that you can stay within the 4 walls of St. Vincent and the Grenadines, or just travel out to the Caribbean to formal meetings, CARICOM or the OECS, or to go to Washington for IMF and World Bank meetings, that sort of a thing, and you can say you want to be the leader of this country, well then, I'm saying to you that such a person will be a failure, because your foreign policy has to be an activist extension of your domestic policy. They are inextricably bound up.
Today, the Argyle International Airport Development Company received 2 donations which will go towards the completion of the airport project. These came from Interactive Media and Friends of the Argyle International Airport. Chairperson of Interactive Media, Carlita Oliver, says the decision was taken long ago to make a donation towards the project, and they are happy to have kept their promise.
We see ourselves not only as a business that takes from the population, but also a business that contributes significantly to the population, because we employ persons, we provide employment, and we're now contributing to the developmental work on a wider scale. We know that the international airport is a significant project. It is a major project, and it is taking a lot of resources which we have to be paying for on an ongoing basis. But it is important in terms of the long-term development of St. Vincent and the Grenadines.
Making their third donation to the project, Friends of the Argyle International Airport President Friends of the Argyle International Airport President Godfrey Pitt says that they felt it necessary to support the project because it will bring significant gains to SVG when completed.
A little over 6 months, I was able to raise funds, work very hard. This organization is working non-stop. And we raised another $10,000. 6 months later, it was presented again for the airport fund through our Governor General. Now I'm here, this is the third presentation with $15,000 US for our airport.
Medical officer reiterates the importance of the National Health and Nutritional Survey and urges Vincentians to give it their full support. We have more stories on the local news scene when SVG-TV's Evening News continues after these messages. Welcome back to the Evening News. Still on the local scene, there is said to have been significant improvements to this country's health infrastructure due to special initiatives taken by the Ministry of Health. That's according to Medical Officer in the Ministry, Dr. Roger Duncan, speaking at the opening day of a one-week workshop for data collection for the National Health and Nutritional Survey. Dr. Duncan noted that while they have taken special initiatives to enhance the country's health sector, the National Health and Nutritional Survey is important to provide baseline data as to what are the risk factors for chronic non-communicable diseases here.
Special initiatives that are taking place now. For instance, diabetic patients now have access to blood glucose monitoring equipment, and that we dispense that in our primary healthcare system just as we would any medication in primary healthcare system. We have had people, our nurses, our family nurse practitioners, our community health aides have been trained in giving dietary advice to patients with chronic diseases. We embark in building more polyclinics. We've constructed one in Stubbs. There's to be another polyclinic to be constructed in Mesopotamia, and one to be built in Document. All these initiatives, all these public health infrastructural development are aimed at better managing chronic non-communicable diseases.
He noted that if the ministry needs to go a step further to develop policies, they will need to have a clearer picture of what is taking place in society.
Much of what exists where. So this step survey, as we call it, is going to be conducted in 3 steps. The first step, or step 1, as we call it, the enumerators are going to come to your households and they're going to ask you things about your demographic data, basically how old you are, what kind of work you do, and that sort of thing. Okay. Step 2, we're going to take some physical measurements. So they're going to be calculating your weight, height, and calculating your body mass index, which itself is a risk factor, depending on what it is for some chronic diseases. And thirdly, and in step 3, we're going to have some biochemical measurements. So some people are going to have the glucose measured, some people are going to have the cholesterol levels measured.
Meanwhile, biostatistician of the Caribbean Public Health Agency, CARFA, Sarah Kesnell-Crooks, says the collection of data for the national survey will be done using a personal digital system.
So this is what you'll see your field workers going into the field, and they'll be using this instrument to collect the data. So we've included technology in the survey, which we're very excited about. I will urge all persons in St. Vincent and the Grenadines, if you're selected to participate in this survey, that you participate in the survey. The information that we'll get from this survey deals with risk factors for chronic non-communicable diseases, and it's so important for our communities and our countries within the region to target risk factors for chronic diseases to try and reduce morbidities and mortalities from these diseases.
Dr. Glennis Andal-Breton, epidemiologist at CARFA, says the week-long training seminar will focus on preparing the enumerators to collect data.
This survey will be implemented shortly after the training, and we'll have the interviewers going into the households and selecting randomly one individual to be interviewed between the ages of 25 to 64 years.
Prime Minister Dr. Ralph Gonsalves says he welcomed the recent judgment in the case involving Jamaican Shanique Myrie versus the Barbados government. The Caribbean Court of Justice, the CCJ, ruled that the Barbados government did in fact breach Myrie's right of entry and ordered that the government pay her $37,500 US plus her legal costs. At today's media conference, Dr. Gonsalves says that the ruling clarifies a wide range of issues regarding the 2001 revised Treaty of Chaguaramas and the decision of the Conference of Heads of Governments in 2007 regarding the hassle-free travel for CARICOM nationals and the automatic 6-month stay. According to the PM, the judgment was a sound one which made a lot of sense, noting that the court didn't say anything that wasn't agreed upon by the heads of member states.
There is an automatic right of entry of CARICOM nationals to other countries in CARICOM. Subject to the rights of the respective states to deny entry on the ground of undesirability, that you're an undesirable person, or 2, that you're likely to be a charge on the public purse. That is, you don't have enough resources to allow you to have the extent of the stay that you want to stay. But the court correctly says that these exceptions must be interpreted and applied in the narrowest manner, because it is the right which is established of automatic entry.